ulcer will not occur. तो इस पंप को, ये जो हाइड्रोजन एंड पोटेशियम पंप है, जो हाइड्रोजन बाहर जा रहा है पोटेशियम अंदर आ रहा है, तो इसको स्टिमुलेट कौन करता है? नंबर वन इज एसिटल कोलाइन। ये जो एसिटल एच इस डायरेक्टली स्टिमुलेटेड करता है इस पंप को। तो सेकंड क्या है? हिस्टामाइन है। ये क्या करता है? ये भी इस पंप को स्टिमुलेट करता है। थर्ड वन इज अ गैस्ट्रिन। ये भी एक वन ऑफ द मैकेनिज्म है, ये भी इस पंप को स्टिमुलेट करता है। एंड द अदर वन इज द प्रोस्टाग्लैंडिन E2। ये क्या करता है? इनहिबिट करता है। और लास्ट एंड द फोर्थ मोस्ट इज दिस प्रोटॉन पंप को अगर हम ब्लॉक कर देते, तो एसिड प्रोडक्शन बंद होने के लिए हमारे पास चार ऑप्शन है। तो फर्स्ट ऑप्शन क्या है? ये जो पंप है, इस पंप को हम बंद कर सकते हैं एसीएच देखिए, ये एसिटल कोलाइन जो स्टिमुलेट कर रहे हैं इस पंप को, ये एसिटल कोलाइन M1 ब्लॉकर देखिए, हम इसको रोक सकते हैं एसिड प्रोडक्शन को। सेकंड, ये जो H2 है, हिस्टामाइन है, ये H2 ब्लॉकर देके भी हम इस पंप को रोक सकता है। या फिर थर्ड जो गैस्ट्रिन है, जो भी पंप को स्टिमुलेट कर रहा है, इस गैस्ट्रिन ब्लॉकर देके भी हम इसको बंद कर सकते हैं। द थर्ड वन इज द PGE2। इसको अगर हम ये इनहिबिट करता है, अगर इसको हम स्टिमुलेट कर देंगे तो ये भी हमें एसिड प्रोडक्शन होने नहीं देंगे। एंड द लास्ट वन इज द प्रोटॉन पंप। अगर इसको भी हम इनहिबिट कर देंगे तो एसिड प्रोडक्शन नहीं होंगे। So again, I will just speak in English. This is the one of the most hydrogen and potassium pump. As we all know that the acid is mainly secreted by the parietal cells, and in parietal cells there's a one pump, and that pump name is the proton pump. And from the proton pump we secrete mainly the acid production. So this proton pump is mainly stimulated by the three things, three receptors. The first one is the acetylcholine receptor, that we directly stimulate this proton pump. The second one is the histamine receptors, which also directly stimulate this pump. The other one is the gastrin receptor. They also directly stimulate this pump. The fourth one is the prostaglandins, which inhibit this pump, and the other one is the proton pump inhibitor. Directly, if we give all these things, then directly the acid production will be less. And our main motto in a peptic ulcer disease is to decrease the acid production, so that we can heal the peptic ulcer. So first of all, I will discuss with the M1 blocker of the acetylcholine. Okay. See, this is the main things which I'm already saying. In order to treat the peptic ulcer disease, first of all, we have to decrease the acid. In order to decrease the acid is mainly produced from where? The parietal cells of the stomach. In the parietal cells of the stomach, there is a pump which helps in the secretion of the acid, and that pump is the hydrogen potassium pump. This is a pump, hydrogen potassium pump. Okay, and this pump is mainly stimulated by the three things. Number one is the acetylcholine, third one is the histamine, and the second one is histamine, and the third one is the gastrin, and the fourth one, the which is inhibited by the acid production hydrogen potassium pump, is the prostaglandin E2. In order to, first of all, we have to decrease the acid, and in order to decrease the acid, first we will deal with the acetylcholine receptor, ACH receptor. So as we all know that ACH, acetylcholine, is secretes in the parietals. ACH is secretes in the parietal cells. So there's a one very in acid, sorry, network issue. In parietal cells, there's a one acetylcholine is mainly secreted from the parietal cells. So can anyone say me what is the receptor present in the parietal cells of the stomach? Here it is written M1 receptor. Can anyone say whether it is the M1 receptors or other receptors? It's actually, it will be the M3 receptors. M3 receptors are situated in the parietal cells of the stomach. Then why I written the M1 receptors over here? M1 receptors are the only receptors which are present on the gastric, present in the stomach of the gastric ganglion. M1 receptors will come to the acetylcholine, it will come to the acetylcholine, it will come to the nearby, because it is a receptor which is present in the stomach gastric ganglia. It will come near the acetylcholine, and acetylcholine will help in the production of the acids, and it will help. Similarly, it will also help in the M3, which is present in the parietal lining of the cells, and for that the acid production will increase. But if I already said that the acid is produced by the parietal cells, so in parietal cell there's a one receptor known as M3 receptor. Suppose if we directly give as medicines, if we directly give drugs in order to block the M3 receptor, then there will be no role in the M1 receptor. No, because we have to target the main area from where the acid is getting secreted. And if we target that area only, then the acid production will automatically down. So in parietal cells, I've already said there's a one receptor present. That receptor name is M3 receptor. Then why I am choosing M1 receptor? Because in M3 receptor is not only present in the parietal cell, but is also present in the smooth muscles of the stomach lining. So as a result, if we give directly M3 blocker, which is already present in the smooth muscles of the stomach, as a result, the peristalsis of the stomach will not happen. Peristalsis, the gastric contraction will not occur. So this is the main reason we are not allowed to give M3 blocker. What we used to give, we used to give the M1 blocker. What is the role of the M1? The M1 blocker, which will that comes to the acetylcholine, which will directly release to the acid, and the M3 also stimulated. And whenever we will give the M1 blocker, there will be no as such gastric contraction will be hampered, and the peptic ulcer disease will be recovered. And whenever if we give the M3 blocker, which is also present in the smooth muscle, as I already said, the peristalsis will not occur. And if peristalsis will not occur, the gastric contraction will not occur. And as a result, what will happen? The acid which already are there in the GI tract, it will remain a longer duration for the time, and the PUD will not be healed up. Hello, hello, Priyaji. Can I am audible? Hello.
Yes, yes, Jaydeep, you are audible.
Okay, because someone replied me right now just in chat box. I don't know, Abhishek Sharma. Sir, yeah, Megha Singh. Sorry, sir, you are not audible.
I think there must be some network issue at their end. I can hear you properly.
Okay, 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 okay.
Yeah, Ashutosh has written, sir, you are audible. Now you are. Okay, you can continue, Jaydeep.
Okay. So what we are discussing about the M1 receptor. So again, I am just speaking in right now. I was now I will speak in Hindi. ये M1 रिसेप्टर, दिस इज द M1 रिसेप्टर. मैंने अभी बोला, ये जो एसिड प्रोडक्शन है वो हमारे पैराइटल सेल्स से प्रोड्यूस होता है, सीक्रेट्स होता है. वहाँ पे एक पंप है, जिस पंप का नाम है हाइड्रोजन पोटेशियम पंप. ये हाइड्रोजन पोटेशियम पंप को स्टिमुलेट करते हैं, एसिटाइल कोलाइन करता है, हिस्टामाइन करता है, गैस्ट्रिन करता है. हमारा मेन एम क्या होंगे? व्हाट विल बी अवर मेन एम? और मेन एम टू डिक्रीज द एसिड प्रोडक्शन. अगर हम लोग एसिड प्रोडक्शन को डिक्रीज कर देंगे, देन वी कैन हील द पेप्टिक अल्सर डिजीज. एसिड प्रोडक्शन को डिक्रीज करने के लिए हमें क्या करना है? एसिटाइल कोलाइन फर्स्ट एसीएच ब्लॉकर देना है, M1 ब्लॉकर देना है. अब एसीएच का जो एसिटाइल कोलाइन है वो कहाँ से सीक्रेट होता है? पैराइटल सेल से. तो पैराइटल सेल्स में एक ब्लॉकर है, जिस ब्लॉकर के नाम है M3 ब्लॉकर. तो अगर डायरेक्टली, मैंने क्या बोला था कि जो ब्लॉकर है, अगर उस ब्लॉकर पे हम लोग डायरेक्टली अगर ड्रग्स दे देंगे तो उससे ज्यादा जल्दी इफेक्ट हो जाएगा, पेप्टिक अल्सर डिजीज भी हील हो जाएगा. बट दिस टाइम वी कैनॉट गिव द M3 ब्लॉकर. क्यों? बिकॉज M3 ब्लॉकर definitely it's present in the parietal cells, but it's also present in the smooth muscles in the of the GI stomach. तो स्मूथ मसल्स ऑफ द स्टोमैक में प्रेजेंट होने के कारण तो क्या हो सकता है? अगर इसको मैं ब्लॉकर दिए M3 का, तो पेरिस्टालसिस जो है वो रुक जाएगा, गैस्ट्रिक कॉन्ट्रैक्टिलिटी जो है, वो कॉन्ट्रैक्शन जो है वो भी रुक जाएगा. सॉरी. इससे क्या होगा? जो पुराना एसिड जो था, दैट विल बी रिमेन ओवर देयर. इससे कोई भी गैस्ट्रिक कॉन्ट्रैक्शन कम कम हो जाएगा और पेप्टिक अल्सर डिजीज हील नहीं होंगे. तो हमें क्या करना है? हमें M3 ब्लॉकर नहीं देना, हमें क्या देना है? M1 ब्लॉकर. M1 ब्लॉकर कहाँ पे प्रेजेंट होता है? गैस्ट्रिक गैंग स्टमक के जो गैस्ट्रिक गैंग्लिया है वहां पे प्रेजेंट होता है। M1 ब्लॉकर क्या करेंगे? वो एसिटाइल कोलाइन को प्रेस करेंगे, एसिटाइल कोलाइन को सीक्रेट पैराइट गोस टू द पैराइटल सेल्स, उधर से वो क्या करेंगे? एसिटाइल कोलाइन को सीक्रेट करेंगे। तो उसको हम लोग क्या करना है? ब्लॉक करना है। अगर हम लोगों ने M1 ब्लॉक कर दिया तो उसमें दो ड्रग्स आता है इन M1 ब्लॉकर। द टू फेमस ड्रग, वन इज द पिरिंजापाइन एंड अदर वन इज द टेलेंजापाइन इन M1 ब्लॉकर। तो M1 ब्लॉक हमें करना है ताकि एसिड प्रोडक्शन कम हो। तो M1 ब्लॉक में दो ड्रग्स आता है, एक ड्रग के नाम है पिरिंजापाइन एंड द अदर वन इज द टेलेंजिपाइन। आफ्टर दैट अगर हम लोगों ने अगर एसिटाइल कोलाइन को अगर हम लोगों ने ये कर दिया तो अदर मोस्ट ऑप्शन है जो स्टिमुलेट करते हैं जो इस प्रोटॉन पंप को, अदर मोस्ट द हिस्टामाइन। यहाँ पे भी लिखा है जो इस प्रोटॉन पंप को H प्लस एंड K प्लस पंप को, जो प्रोटॉन पंप को ये स्टिमुलेट करता है थ्री थिंग्स से। ACH करता है M1 रिसेप्टर, द सेकेंड वन इज द हिस्टामाइन रिसेप्टर H2 रिसेप्टर। अगर हम लोग H2 ब्लॉकर देंगे तभी भी हमारे क्या होंगे? ये जो एसिड प्रोडक्शन से ये कम हो जाएगा। Histamine कब जब receptor से that receptor is the H2 receptor. This also secretes in the parietal cells. So acetylcholine and the gastrin helps in acetylcholine. Just remember one thing: acetylcholine and the gastrin, this together help in getting histamine secretion. They help in histamine secretion. So if we give the histamine blocker, H2 blocker, then also the acid production will be less. And what are the drugs in the H2 productions? And all the drugs in the H2 blockers are ends with the tidine. Whenever there's written the end last word, the tidine, no, it will just, you have to keep it in your mind that these are all the drugs which are helpful in decreasing the acid production, because these are the drugs which directly stimulate histamine directly stimulate the proton pump, hydrogen and the potassium pump. So these are the drugs will decrease the acid production and will helpful in the peptic ulcer disease. The drugs which comes under the tidines are the cimetidine, ranitidine, famotidine and the nizatidine. These are the main drugs which comes under the H2 blockers. But there's a one more thing, there's a few questions comes regarding the cimetidine, because cimetidine many of the times, most of the times, they will not ask that the out of these one is the ranitidine, which one is the H2 blocker. They will not say, because they will know that the drugs which ends with the tidines, everyone knows that's the H2 blockers. But what how they used to set up the questions, there is a few criteria regarding the cimetidine. Cimetidine is a one drug which have a lot of side effects. So I will discuss this cimetidine. Cimetidine is a one drug which is mainly the most potent microsomal enzyme inhibitor. Most potent microsomal enzyme inhibitor mean if cimetidine is the drug which causes many drugs to drug interaction or drug toxicity. Also, cimetidine you can also write over here. Cimetidine is the one drug which can causes the gynecomastia. Gynecomastia causes mean cimetidine. Cimetidine causes gynecomastia, but there's a one mnemonic. The drugs which are causing the gynecomastia, it you can be remembered by the famous mnemonic, and the mnemonic name is a disco. Disco. By the mnemonic disco, you can remember that the drugs which can causes the gynecomastia. And regarding the disco, what are the drugs? DI, DISCO. DI stands for the digoxin, S stand for the spironolactone, C stand for the cimetidine, and O stand for the estrogen. So, what are the drugs that causes gynecomastia? Most of the time, the invigilator is to ask. So, you have to remember the drugs which can be caused by the gynecomastia. Will be remembered by this mnemonic, and the mnemonic is the famous DISCO. DISCO. DI stands for the digoxin, A stands for the spironolactone, C stands for the cimetidine, and O stands for the estrogen. See, this is the written the H2 blocker tidines. What are the pharmacodynamic drug action? The H2 blockers are the antagonists at the receptors in the parietal cells of the stomach. The blockage result to the inhibition of the hormone gastrin. I've already said that the acetylcholine and the gastrin, this together help in the production of the histamine secretion. So this also results in the blockage of the gastrin. Then there is a decreased production of the gastric acid from the parietal cells, and also the chief cells will secrete less pepsinogen. The main motive, the main motto of the H2 blocker is to decrease the acid production from the parietal cells. Remember, the same as the acetylcholine M1 blockers, the main motto is to decrease the acid production. The tridines also, the H2 blockers is also the decrease the acid production. So someone written their case with the disco. The DI stand for the digoxin, DI stand for digoxin, S stand for spironolactone, C stand for cimetidine, and O stand for estrogen. Digoxin, again I am saying the drugs which causes the gynecomastia. DI stands for digoxin, A stands for the spironolactone, C stands for cimetidine, and O stands for estrogen. Then these are the H2 blocker tediums, mainly the side effects or the adverse effects, whatever you can say. In GIT, it can cause the diarrhea or the constipations. In GIT, it mainly causes the diarrhea or the constipation. In CNS, it causes the confusion, dizziness, drowsiness, hallucination. In cardio, it causes the arrhythmia and hypotension. But the most important MCQ comes from the TDN is the drug which causes the gynecomastia, and the importance in males is the drug cimetidine. Okay, from the digoxin, from the disco pneumonic, the C stands for the cimetidine, and it's one of the most important questions in MCI also, the drugs which can causes gynecomastia, and out of that is the cimetidine will be the answers. So these are the, you can have said that the mostly the tedious drugs, especially the cimetidines, these are the one of the most powerful microsomal enzyme inhibitor. Means microsomal, it can show the drug to drug interactions and the drug toxicity. The cimetidine, famotidine, ranitidine are metabolized in the liver. Therefore, this can lead to the increased concentration of the other drugs. It means they used to interact with the many other drugs. Whenever we used to take, there is some route, the CYP2C19. Whenever we have to give the drug, we have to avoid the drug to drug interaction, so that there will be no drug to drug interaction, and there will be least portion of drug toxicity. But in cimetidine, this is the most powerful microsomal enzyme inhibitor. So in cimetidine, we can see the many drug to drug interactions and also the drug toxicity. The mainly the cimetidines are the drugs which can causes by the interactions of the anticoagulants, which mainly causes the phenytoins, alcohol, and the antidepressants. Means whenever if any person is taking alcohol or if any person is taking antidepressants, then we will avoid the drug cimetidine, because we don't want any drug to drug interactions, as it is one of the most powerful microsomal enzyme inhibitors. Then the last most is the PP. Othermost things in over here, we already discussed the acetylcholine, then the histamine, and the gastrin. In gastrin, just remember only one receptor, and the gastrin receptor is known as CCK, cholecystokinin. There are no medicines for the CCK, so we will not discuss about any such medicines from the gastrin. We will just only remember the name. The in gastrin, there's a one receptor name which is known as CCK, cholecystokinin receptors. So these are all the three things which are mainly stimulated the hydrogen potassium pump or the proton pump. The after that we will discuss about the prostaglandin PGE2. PGE2, as I already said, that it's inhibit. As I already said, these are the three things. There's the acetylcholine, histamine, and the gastrin. These three things stimulate this pump, and the one thing which inhibit is the known as the prostaglandins E2, PGE2. What is the role? It is one of the most protective factors of the peptic ulcer disease. We will just remember that PGE2 is one of the most protective factors, prostaglandins. So, how this is helpful? It inhibits the proton pump, number one. Second is prostaglandin, as I already said, that in peptic ulcer disease occurs only when there's a disbalance between the aggressive factors and the protective factor. Aggressive factors are HCl and the H. pylori, and the protective factors are mucus and the bicarbonate. But the PGE2, how it helps? It helps. What is its mechanism of action? PGE2 firstly is inhibit this pump so that the acid production will be less. Second, it mucus and the bicarbonate, which are the defensive factors, it increases this protective factor, mucus and the bicarbonate. Side by also, it increases the mucosal blood flow by the vasodilation. Whenever they increase in the blood flow, it means there will decrease inflammation. So PGE2 will helpful in all these things. So there's a one question. If not PGE2, then there will be increase in the ulcer? Definitely. If there's no PGE2, then the ulcers definitely will increase. There's a one drug which directly induced the peptic ulcer. We inhibit the stop PGE2, and that the drug is known as a NSID, non-steroidal anti-inflammatory drug. Non-steroidal anti-inflammatory drug induce peptic ulcers. How? Because it inhibits this PGE2. But PGE2, there's a one drug name from the PGE2, and the drug name is the Misopristol. The PGE2 पे एक ड्रग है जिस ड्रग के नाम है मिसोप्रिस्टॉल. NSAID इंड्यूस करता है पेप्टिक अल्सर. वो पेप्टिक अल्सर कैसे होता है? जो PGE2 को बंद कर देता है. तो उस PGE2 को अगर एक बंद करने के लिए एक ड्रग है जिस ड्रग का नाम है मिसोप्रिस्टॉल. But misoprostol is one of the very toxic drug. It causes abortion and diarrhea. So we will not give misoprostol any pregnancy. Okay, in pregnancy, because it's a very toxic drug and it mainly causes so abortion and diarrhea. So misoprostol is not used. The drug which comes under the PGE2. There is a one very good questions every time used to come in MCI or any other UPSC exam or any other competitive exam. If suppose anybody is taking NSAID, non-steroidal anti-inflammatory drug. So if anybody is taking NSAID induced, if anybody having peptic ulcer due to NSAID, non-steroidal anti-inflammatory drug, then what will be the drug of choice? Then the drug of the choice will be the PGE2 drug. That's the misoprostol. But overall, if anyone says what will be the drug of choice for the peptic ulcer, that will be the proton pump, PPI, proton pump inhibitor. But the main thing, if anybody asks that what will be the drug of choice for the NSAID, अगर नॉन स्टेरॉइड एंटी इन्फ्लेमेटरी ड्रग की वजह से किसी को पेप्टिक अल्सर हुआ, उसके लिए अगर कोई भी ड्रग ऑफ चॉइस है, then the drug of choice will not be the PPI, then the drug of choice will be the misoprostol. PPI will be the drug of choice overall case, in general case, except the NSAID. But apart from that, the PGE2 drug, the misoprostol, is very toxic and it can causes abortion and diarrhea. So nowadays it's not used. The most important thing is the proton pump inhibitor, PPI inhibitor. So we can come to the fourth option where I written the fourth, PPI. It is one of the most strongest acid stimulation. Agar proton pump inhibitor will give though a strong, it is one of the most strongest. The acid will not secrete. So all the proton pump drugs, they will all ends with ozone. I will just show one slide. The all the proton pump drugs, okay, they are all ends with the prazoles, ols. The prototypes, the drugs which comes under the PPI are the omeprazole, lansoprazole, esomeprazole, pantoprazole. Whenever there will be the ol, OLE, prazoles. Okay, you have to just keep it in mind that these are the drugs of the PPI, proton pump inhibitor drugs. So the you can also write over there other one more drug, dexlansoprazole, omeprazole, lansoprazole, esomeprazole, pantoprazole, and dexlansoprazole. These are the drugs which comes under the proton pump inhibitor PPI criteria. Over here we can write that over here I will give one or two MCQ. Drug of choice for the proton pump PPI in mainly the peptic ulcer. Okay, this I have already said. Okay, the drug of choice for the peptic ulcer disease will be the PPI. Besides that, also in gut, gastroesophageal reflux disease, where the acid production is very high. Also over there also we can use the drug of choice, the proton pump inhibitor PPI, because we have to deal with the we have to decrease the acid in gut also. So in GRD, the main drug of choice will be the proton pump. And the other thing, other one more disease that ZES. ZDS, what stands for? It's the mainly the Zollinger-Ellison syndrome, gastrinoma. Over there also the role of the acid production. So in these two cases, apart from the peptic ulcer, GERD and the Zollinger-Ellison syndrome, the proton pump inhibitor can be used as a drug of choice. Now, it's a very good. Now, proton pump inhibitor, how, what is the mechanism of actions of the proton pump inhibitor? Is it directly acts on the stomach parietal cells, or it acts on the other sideways? Okay, so I will just show you one, I will just explain you right now the mechanism of action of the proton pump. How does it work? Suppose we take one medicine, and the, as I already said you, that every proton pump medicine ends with the prazoles. So I am taking one example of famous good brand name everybody knows, whether they are stayed in Russia, India, anywhere. Okay, omeprazole. Anonymous attendee, you said that the please repeat the drug of choice. Okay, the NECID induced, at least I think I will discuss all these questions and answers at the end of the topic. Okay, if I discuss this question and answer, it will be making a huge time together. Okay, taking a bit more time. So I will discuss all this at the end of the session. So what I'm saying is that the proton pump inhibitor. Okay, so I'm taking one example of the proton pump inhibitor and how does it work. Okay, so let's suppose take an example of famous. Everybody knows that brand name, and the brand name is the omeprazole. Everyone knows, whether they were sales in Russia, America, India, everywhere. So omeprazole, we are taking one example. So if we take omeprazole directly from oral intake, okay, so where it will go and how does it work? It will, how it will go? It will directly go to the stomach and it will inhibit this proton pump, as if, I think this is the main reason. No, how this proton pump, the main reason is to, we have to decrease proton pump, we have to inhibit this proton pump so that the acid production will not occur. So whenever we will take the omeprazole by oral intake, so it will directly go to the stomach, and from stomach it will go to the proton pump and it will inhibit the proton pump. But the answer will be no, this is not the mechanism of action of the proton pump inhibitor. Then how the proton pump inhibitor works? Proton pump inhibitor, whenever we used to take from the oral, it will go to the stomach, and before it inhibit the proton pump, it has to enter to the parietal cells in order to work. So until and unless the omeprazole, lansoprazole, any prazoles, it will doesn't go to the parietal cells, it will not work, it will not inhibit the proton pump. So whenever for that, what we have to do, for what the drug have to do, so whenever we used to take the drug omeprazole, so early in the morning, so pantoprazole, so oral intake, it directly goes to the intestine, and from the intestine it absorbs, from there it absorbs, it enters into the blood, and from blood it goes to the parietal cells, and from there it inhibits the proton pump inhibitor. So how does it work? From the mouth oral, after taking, it goes to the intestine, from intestine it absorbs, and after that it goes to the blood, and from blood it enters into the parietal cells, and from the parietal cells it inhibits the proton pump inhibitor. And this is means it, how this systemic action, not a local action, it is a systematic action. So mechanism of action of the proton pump is a systematic action. It will not directly from the mouth, it will go to the stomach, and after that it will inhibit the proton pump. From the mouth it will go to the intestine, from there it will absorb in the blood, and from the blood it will go to the parietal cells, and from parietal cells, in order to work, it will, in order to stop the hydrogen potassium pump, it will stop it. And so this action is known as a systematic action, and it is not a labile action. But One disadvantage is that is the this is the proton pump inhibitor is an acid level drug, means the acid HCl acid which are present in the stomach, it will break the proton pump inhibitor, it will not allow the proton pump inhibitor to work. Then how come proton pump inhibitor will work on that medium? So before making this drug proton pump inhibitor, we used to make one special covering, and that covering is known as enteric coating. We have to make that drug with the coating so that in in GI, whenever it will reach the stomach in the acid medium, it will not break, because it's an acid level drug. And whenever we used to coat, this is a coating is the enteric coating, or it is a special coating covering, and that special covering allow the drug to dissolve in the basic medium or in alkaline medium, so it will helps the drug from the breakdown in the acidic medium. So in intestine, we all know that it's an alkaline medium, so it will absorb over there. One more thing, this is a proton pump inhibitor. These are all are the pro-drug. Pro-drug means in blood there's a acid in blood, there's a pH is 7.4. Okay, it will go over, it will go to, it will act, it will secretes into the parietal cells, and in parietal cells there is a much more production of the acidic, and it will go over there, and after that it will work over there. So how it's so how the proton pump works, again I will speak out. So proton pump एक ऐसा proton pump है, जैसे इसका एग्जांपल्स हम लोग ले लेते ओमिप्राजोल से। ये ऐसा एक दवाई है जिसको हम लोग इसका मैकेनिज्म ऑफ एक्शन को अगर बोले किसी ने, अगर इसका मैकेनिज्म ये कैसे हमारे शरीर पे काम करता है, बेसिक फंडा है कैसे हमारे शरीर पे काम करते हैं। हम लोग अगर खा लिया इसको, तो ये डायरेक्टली स्टोमक पे जाके इस प्रोटॉन पंप को बंद नहीं करेंगे। ये कैसे बंद करेगा, ये फर्स्टली इंटेस्टाइन पे जाएगा, इंटेस्टाइन पे जाके इसको ब्लड पे एब्जॉर्ब होना है, एब्जॉर्ब होने के बाद ये पैराइटल सेल में जाएगा। अगर अनटिल एंड अनलेस इट एंटर्स द पैराइटल सेल, ये प्रोटॉन पंप जो है इसको इनहिबिट नहीं कर पाएंगे। सो इट इज अ सिस्टमेटिक एक्शन ऑफ द पीपीआई, प्रोटॉन पंप इनहिबिटर। प्लस ये जो पीपीआई है ये एसिड लेवल है, मीन्स क्या है, ये जो हमारे स्टोमक पे एसिड सिक्रेशन होता है वहां पे ये ब्रेक हो जाता है। अगर हम लोग इसको ब्रेक नहीं होने देंगे, हम चाहते हैं ये काम करे, तो इसके लिए कैसे काम करना है, तो ये जो ओमिप्राजोल जो भी प्रोटॉन पंप इनहिबिटर है, ये एक स्पेशल कोटिंग इसके ड्रग के ऊपर कर देते हैं, ताकि क्या है, उस कोटिंग का नाम है एंटेरिक कोटिंग। वो कोटिंग एक स्पेशल कोटिंग होता है, वो दोनों ही जगह पे डिसॉल्व हो सकता है, एक बेसिक मीडियम पे, एक अल्कलाइन मीडियम पे। और हमें पता है एसिडिक मीडियम पे डिसॉल्व नहीं हो सकता है, जो काम ही नहीं करे, तो इंटेस्टाइन ऑलरेडी अल्कलाइन है, तो वहां पे जाके ये ड्रग क्या होता है, डिसॉल्व हो जाता है। एंड इट्स अ प्रो ड्रग, मीन्स ये सीक्रेट हो रहा है कहाँ पे, ब्लड पे, जहाँ पे 7.5 पीएच इनएक्टिव है, एंड इट विल एक्टिव करने के लिए इसको एसिडिक मीडियम चाहिए। आफ्टर दैट इट सीक्रेट्स इनटू द पैराइटल सेल्स, जहाँ पे वो एसिड के हेल्प के वजह से इट एबल टू do its action, and this is the full mechanism of action of proton pump inhibitor. But one more thing, proton pump inhibitor क्या है, permanent inhibition of proton pump है, मीन्स परमानेंट इनहिबिटर है, ये बिल्कुल खत्म कर देता है, एंड इट्स इरिवर्सिबल है, इरिवर्सिबल प्रोटॉन पंप इनहिबिटर है। इसका हाफ लाइफ है, अगर देखा जाए ओमिप्राजोल का हाफ लाइफ है 30 मिनट्स, मीन्स एक आते हैं इसका 30 मिनट में, विद इन 30 मिनट्स ये अपना काम कर, इट विल finished its work and it will go. So there's some drugs in pharmacology. We all know that drugs are known as hit and run drug, and we can remember the hit and run drug by the famous Bollywood actor Salman Khan. Because Salman Khan, what he used to do, if anybody there is Salman Khan fan, so please forgive me. So what Salman Khan used to do, one at a time, on a, on one day, one what he used to do, he was drunk and he just hit someone and he went out. So in pharmacology also there are some drugs, just like Salman Khan, they used to come, they used to show their action, and after that they used to go from that side. Okay, and that drug name as the hit and run drug, because any pantoprazole, omeprazole, we used to take once a day early in the breakfast, means whenever tea half is 30 minutes, means whenever we used to take that drug, no, that drug used to come in our, come into the action within 30 minutes. Is he used to do its action, and what he used to break this hydrogen potassium pump for 24 hours, so that no acid production will occur. And in order to generate, in order to heal this pump, in order to reconstruct this pump, that pump did 24 hours again. So every time this drug used to come within 30 minutes time of duration, it will come, it will do its action, and after that it's go. So these drugs are mainly known as a hit and run drug. So there in pharmacology, over here only I will mention you, there are some drugs which are also known as an hit and run drugs. So the first drug is the proton pumps drug. If anyone asks you what are the hit and run drugs, so first of all will be the first of all will be the hit and run drug, and the second, first if anybody said what are the drugs comes under a hit and run category. Hit and run category make drugs which comes under the PPI drug. The first one, second one is the aspirin, and the third one is the Mao inhibitor. In Mao inhibitor, I will discuss with the CNS. Okay, so just remember these three drugs which comes under the hit and run category. The one is the PPI proton pump inhibitor. The other one is the aspirin, and the last one is the Mao inhibitor. So right now I will just show you something. this is the this is what I've already discussed. These are the PPI, the newer treatment, the prazos, omeprazole, lansoprazole, esomeprazole, and the pantoprazole. Over here you can also, and one more thing, the I just forgot to discuss the PPI. The PPI drugs are, there's no as such any side effects of the PPI drug, but once in America when the PPI drug was used, okay, in rats only, not in human beings, okay, in rats. I'm mentioning in rats. In rats, the PPI shows some carcinoid syndrome, carcinoid sign. So maybe keep it in mind. Maybe in future, in any human being, it can be occur. But as such, in no humans, the syndrome no occur carcinoid. But in rats, okay, the carcinoid syndrome occur. But other disadvantage of the PPI is what PPI क्या करता है, व्हाट इज द रोल ऑफ पीपीआई, it pH को चेंज कर देता है, मींस pH is to changes the pH from the acidic to the alkaline. So it, by doing this, the patients who was a long term of PPI, they face mainly the two side effects. One is the calcium deficiency, and the other one is the vitamin B12 deficiency. In calcium deficiency, in long term, the patient may face the osteoporosis, and in vitamin B12 deficiency, the patient may face the megaloblastic anemia. So if anyone asks what is the main side effect of the long-term PPI, just the two things. The decreased calcium results in the osteoporosis, and the other vitamin B12 causes the megaloblastic anemia because it changes the pH. So this is the two main side effects. Rather than there's no as such side effects of the PPI. So I'm just explaining one again. See, these are the drugs which comes under the PPI. And what is the drug to drug action? I have already explained to that this act as specific surface receptor to prevent the acid production and thus decrease the acid production of the acid in the stomach. These pumps are mainly in the parietal cells, H and hydrogen potassium ATPase system, which takes presence on the gastric parietal cells. B12 causes megaloblastic anemia. So after that, the clinical uses of the PPI, as I already said, the proton pump inhibitor is a drug of choice for the peptic ulcer disease. But apart from that, peptic ulcer disease is also a drug of choice in the GERD, gastroesophagus reflux disease, and the other one is the Zollinger-Ellison syndrome. In gastric esophagus reflux disease, our main motto is to decrease the acid production. So there also we will use the PPI, and in also the duodenal ulcer, also in benign gastric ulcers also. And long term of the maintenance therapy causes the erosive disorders. Of So before that antacids, again I will just review this thing. This is the main thing in the GIT. So please be pay attentive regarding this GIT. GIT, the main topic is the main in GIT, the main topic is the peptic ulcer. So how to treat the peptic ulcer, and if anybody knows this mechanism of action, if anyone knows this pump how to stop this pump, or how this pump works. Okay, so in GIT everything will be easier. This is the complicated thing, and after that everything will be easier. So once more I am just repeating this pump. Peptic ulcer in GIT, the first thing, still right now I am saying the peptic ulcer disease. Peptic ulcer is mainly caused due to the two factors. One is the aggressive factors and other is the protective factors. Aggressive factors is the H cell and the H pylori, and the protective factors is the mucus and the bicarbonate mucus and the bicarbonate. So in order to heal the peptic ulcer, what we have to do, we have to decrease the acid production. As soon as we will decrease the acid production, or when we'll increase the mucus protective covering, okay, so the peptic ulcer will automatically heal. So how in order to heal, in we all know that the acid is mainly produced from the parietal cells, and in parietal cells there's a one pump, and that pump is known as an hydrogen potassium pump, HK plus hydrogen potassium pump. This pump, see, this is the pump, hydrogen potassium pump, which helps in the acid production from the parietal cells. This is the pump, which pump is mainly stimulated by the three things. One is the acetylcholine, second one is the histamine, and third one is the gastrin. This is the three things which helps the or which stimulate this pump to produce the acid secretions. And one more thing, the prostaglandins, this inhibit the pump. They means this inhibit from the acid secretions, and the other is the proton pump. So what we will do, we will give the blocker so that no acid production will occur, and we can treat the peptic ulcer disease. So the first and foremost is acetylcholine. As I already discussed, that acetylcholine is also a receptor which directly stimulates the hydrogen potassium pump. We have to block the acetylcholine. How we will block this acetylcholine? Acetylcholine is mainly secreted from the parietal cells. In parietal cells, we have a one blocker, and that blocker name is the M3 blocker. So if we directly give the M3 blocker, we can reduce the acid production. Is it right? Definitely we can, it is right. But in clinically use, in practical use, we don't do this much, because we don't do this thing. Why? Because these M3, they are not only present in the parietal cells, these are also present in the smooth muscles of the GIT. If we give the M3 blockers, so what will happen? The peristalsis will not occur. What will happen? The gastric contraction will not occur. So as a result, what will happen? The acid, which is the long standing acid, the acid which are already produced over there, will remain over there in long standing way. So what we will do, we'll keep one receptor known as an M1 receptor, where M1 is secreted. M1 is present in the stomach gastric ganglion. It comes to the receptor acetylcholine, and from there it will acid production of the acids and the M3. So we'll give some drugs so that M will not able to produce the acetylcholine, and the acid production will occur. So the drugs which come under the M1 are the two drugs, the famous drug, very easy to remember. One is a pirenzapine, and the other one is the telenzapine. The othermost thing is the other thing is the histamine, the other thing which stimulates this hydrogen potassium pump. Sorry, what the histamine is to secrete? Histamine is as a receptor which presents in the H2 receptor, is also present in the parietal cell. What histamine do? Acetylcholine and the gastrin, these together also helps in the histamine secretion. So any drugs which also will give the H2 blocker, so that to decrease the acid production. And the drugs which comes under the histamine category are the drugs which ends with the tidines, ranitidine, cimetidine, famotidine, each and everything. Okay, so in all these things, I will discuss one thing, the cimetidine, because cimetidine is the one drug which causes so many side effects, and the invigilator also used to ask about cimetidine, because cimetidine was one of the most microsomal enzyme inhibitor, means it causes drug to drug interactions. If anybody is taking phenytoin, if anybody is taking alcohol, if anybody taking antidepressants, we should not combine with the histamine. Okay, cimetidine. And othermost thing, what cimetidine needs to do, cimetidine causes gynecomastia. Gynecomastia means female like breast in human, in males. Okay, so the drugs are also causes gynecomastia, with the famous mnemonic is the disco. Di stand for the digoxin, A stand for the spironolactone, C stand for the cimetidine, and O stand for the estrogen. These are the drugs which causes the gynecomastia. The third most thing is the gastrin. In gastrin, just we have to remember only one receptor, and that receptor is the CCK receptor. Still now, as such, there is no medicine come for the gastrin. So we have to remember only one receptor present for the gastrin, and that receptor is known as cholecystokinin receptor. After that, what we can do, we have to PGE to prostaglandin. It inhibit the it inhibit the acid production. It inhibit the pump, the hydrogen potassium pump, and it is one of the most protective factors of the peptic ulcer. How does it? Mechanism of actions, it inhibits this pump, hydrogen potassium pump. It allows the mucosal blood flow, vasodilation, increase in the blood flow to heal the inflammation. And other thing, it also causes, it increases the protective factor of the mucus on the bicarbonate. So in its PGE2, this is the main mechanism of action in treating of the peptic ulcer disease. If PGE2 is not occur, then there are chances of increase in the ulcer. So there's a one question. NSAID is a drug, non-steroidal anti-inflammatory drug. NSAID induce peptic ulcer, then what will, if NSAID causes peptic ulcer, then what will be the drug of choice? Then the drug of choice will be the Misopristol, which comes under the PGE2 category. If NSAID cause induced peptic ulcer, then the drug of choice will be the PGE2. Misopristol is very toxic. It causes abortion and diarrhea, so it's not used nowadays. So there's a one very famous question for the invigilator. If NSAID induced peptic ulcer, then what will be the drug of choice? That time, please don't write proton pump inhibitor, because that time that inhibitor wants to know, inhibitor know that you will say that proton pump inhibitor, but and whenever you will give the MCQ, no, whenever you will write for the MCQ, the proton pump inhibitor will be the first option, because inhibitor know that maximum what will be they do, they will in a hurry mode and they will mark the proton pump inhibitor, and you guys will lose one mark. So please be very cautious that what invigilator wants to know. If the invigilator wants to know that the NSAID induced peptic ulcer, then the drug of choice will be the Misopristol. Or overall, in proton pump and peptic ulcer disease, the drug of choice will be the PPI, proton pump inhibitor. And after that, will come the proton pump. Proton pump is one of the most strongest acid inhibitor. Okay, so it is a drug of choice without any hesitation for the peptic ulcer disease. Still also, further, it is a drug of choice for the gastroesophageal reflux disease also, and Zollinger-Ellison syndrome also. So how does proton pump inhibitor work? Mechanism of action of the proton pump inhibitor. If we, whenever we used to take the proton pump inhibitor orally, okay, it doesn't work just like that. It first it enters the stomach, and from stomach it inhibit the proton pump. No, it doesn't work like that. Whenever we used to take the proton pump orally, after that it go to the intestine. From intestine it absorbs over. From there it comes to the blood. From blood it goes to the parietal cells, and from the parietal cells it inhibits the proton pump. So this is the main mechanism of action of the PPI. Means it is a systematic action of PPI. Plus PPI is an acid level drug. Means in GI there's a acid production. There's a very acidic, so it will break the proton pump. The example omeprazole, it will break the omeprazole. So in order to work for the drug, what we is to do, we is to made a special covering, and that covering is coated with the enteric coating. What does this enteric coating significance? This enteric coating significance means they doesn't allow the drug to be break down in the acidic medium. They allow the drug to be dissolved in the basic and the alkaline medium. So in intestine we all know there's an alkaline medium, and so over there this drug absorbs and it causes it, and it does its work. So plus beside this drug is a pro-drug. Pro-drug means in active. So in blood also 7.4 in PPI misoprostol is a pro-drug. Means inactive from it secretes from the blood 7.4. From there, in order to get its work done, it will secretes in the parietal cells in acidic medium, and from there, where the acid concentration is more, it starts its working. And other more thing in PPI, it is a permanent inhibitor. Means it comes if we take the T half. T half means how much time that this drug works. Okay, the T half of this drug is only 20-30 minutes, means it will come and it will do its work, and after that it's go. It is causes mainly is known as hit and run drug, just like Salman Khan, he just hit and run. Okay, so there is some drugs which used to come and hit and run. In hit and run in this perspective means, how hit and run in this perspective means, the drug, the omeprazole or pantoprazole, we earlier we should take early in the breakfast. Okay, BBS, before breakfast, means they used to break this pump, and in order to repair this pump need 24 hours. So they used to come and they used to do their job, and after that they used to go. So this is known as a heat and run drug. In heat and run drug, the three drugs is to come. One is the proton pump inhibitor, other one is the aspirin, and the third one is the Mao inhibitors. So, and what are the side effects of the PPI? As such, there is no very side effects, but in US, once in a time, in rat, it causes the carcinoid syndrome. So we have to be careful. No, I will not say careful. Okay, just remember, once it causes in rats, no human beings, it causes the carcinoid syndrome. But the main side effects of the long term, if any patients, if anybody wants to ask you that, if any patients are taking a long term PPI, then what will be his side effects? There will be two side effects mainly, because what the PPI used to do, it used to changes the medium, it used changes the alkaline medium. So what it will do, it will decrease the two factors. One is the calcium deficiency it will causes, and the other thing, vitamin B12 deficiency it will causes. For long term, due to the deficiency of the calcium, the patient may have osteoporosis. Due to the deficiency of the calcium or due to the deficiency of the vitamin B12, the patient may have megaloblastic anemia. I think now is better to answer all the questions. Sir, can you please repeat? In case of please repeat the drug of choice for the, I think one is anonymous attendee. He messaged me for the please drug of choice. The drug of choice for the, I think you, for what the drug of choice in gynecomastia, the drug of, please repeat the drug of choice, for drug of choice for what thing? अगर NSAID induced peptic ulcer है, then the drug of choice will be the misopristol. If NSAID induced peptic ulcer, otherwise for the peptic ulcer disease, the drug of choice will be the PPI. Sir, I did not. Then Megha Singh replied, Sir, I did not get the importance of enteric coating. Huh? Megha, enteric coating, Megha Singh, the enteric coating is what? So in PPI ड्रग को क्या होता है, पीपीआई ड्रग को अगर हम लोग डायरेक्टली इसको दे नहीं सकते, अगर हम लोग डायरेक्टली देंगे तो ये एसिड लेबल ड्रग है, मीन्स ये हमारे स्टोमक में जाके जो एसिड प्रोडक्शन है वहाँ पे ये ड्रग ब्रेक हो जाएगा, उसके बाद ये ड्रग का कोई काम नहीं आएगा। तो इसके लिए हमें क्या करना है, वो ड्रग को एक ऐसे कोटेड कर देते हैं, ऐसे जैसे टैबलेट है, टैबलेट के ऊपर एक कोटेड रहते हैं, उसी कहते हैं एंटेरिक कोटिंग। उस एंटेरिक कोटिंग का क्या हेल्पफुलनेस है, वो एंटेरिक कोटिंग क्या हेल्प करता है, दैट एंटेरिक कोटिंग अलाउज द ड्रग टू बी डिसॉल्व्ड ओनली इन द बेसिक और अल्कलाइन मीडियम, so it will not allow the drug to be dissolved or to break down in the acidic medium. So that's the role of the enteric coating. The anonymous attendee written, sir, B12 causes, vitamin B12 causes megaloblastic anemia. B12 causes megaloblastic anemia. The long-term patients will be taking the PPI may suffer from the two things. One is the calcium deficiency, there is the osteoporosis, and the other one is the vitamin B12 deficiency, and there is a megaloblastic anemia. Then Bhavna, she she have a query. Please repeat heat and run drugs again. What are the heat and run drugs? Heat and run drugs means, just remember Salman Khan story. Heat and run drug means the one who come, heat, and after that he go. Okay, this is the main thing, heat and run drugs, because he will, the drugs, the drug can be heat and run drug. It will come, it will hit the, it will hit the slot, and after that it will run, means it will be excreted from the body, just like the PPI. It is a permanent, the T half, the PPI, the T half is for 30 minutes. So 30 मिनट के लिए वो आते हैं, उसका एक्शन स्टार्ट हो जाता है। जैसे whenever action is finished, whenever his work is finished, it just stop and it will just run away from the site, means it is excreted from the body. but उसके बाद वो ड्रग हमारे जो H एंड पोटेशियम एंड हाइड्रोजन जो पंप है, उस पंप जनरेट करने के लिए, मैन्युफैक्चर होने के लिए 24 आवर्स लगता है। तो वो आते H एंड पोटेशियम पंप को स्ट्राइक करके वो निकल जाता है। दिस नोन एज एन हीट एंड रन ड्रग। एक बार आए, अपना काम किया, आफ्टर दैट ही वेंट आउट। तो 3 कैटेगरी ऑफ ड्रग्स आते हीट एंड रन ड्रग्स में। पीपीआई आते नंबर 1, सेकंड आता है ये aspirin, and the third one is the Mao inhibitors. H, what Bhavna again what is the receptor for the gastrin? The gastrin receptor is the cholecystokinin, CCK. Sir, can you repeat the example of heat and run drugs? Heat and run drugs, again I am said there are 3 drugs which comes under the heat and run drug. One will be the proton pump inhibitors, the other one is the aspirin, and third one will be the Mao inhibitors. There's a one good question, anonymous written, how M1 receptor of the stomach ganglion reduce the acetylcholine? See, I have already said the M1 receptor is present in the gastric, is present in the stomach in gastric ganglion. So what it will do, it will go to the M1, it will go to the parietal cells and it will release the acetylcholine. जो M1 receptor in F1 receptors, it will present, it will go, it will present, it is already present in the stomach gastric ganglion. It will go to the parietal cell in order to reduce the acetylcholine, and automatically it will also the M3. So if we give the blocker, M1 blocker, it will not be able to it will not be able to excrete, it will not be able to produce or release the acetylcholine, and how far the ACH will decrease and the acid production will also be decreased. NSAID, one after that one more anonymous, he says NSAID induced peptic ulcer drug of choice. See, agar if someone is taking NSAID, non-steroidal anti-inflammatory drugs, okay, and for that, if anybody experience the peptic ulcer, then the drug of choice will be the Misopristol, PGE2, Misopristol. So that will be the, or else if anybody is not taking the overall, the drug of choice for the peptic ulcer will be the proton pump inhibitor. But if anyone is taking the NSAID, then the drug of choice will be the, because what NSAID will do, NSAID is to inhibit the PGE2. So in order to, if the PGE2 is not there, because as I already described, said you that PGE2 what it causes, it inhibits the proton pump, number 1. Second, it increases the mucosa, it increases what, the protective factor, mucus and the bicarbonate. So what NSAID is to do, NSAID is to inhibit the PGE2, and as such it inhibits the PGE2 and the acid production is increases and the peptic ulcer occurs. So then that time the drug of choice will be the Misopristol, or overall the drug of choice will be the proton pump inhibitor, PPI. Sir, please spell the drug causing gynecomastia. The drug causing the gynecomastia can be remembered by the mnemonic DISCO. I stand for the digoxin, A stand for the spironolactone, C stand for the cimetidine, and O stand for the estrogen. One written that, sir, what is the difference between the drug of choice and the overall drug? Drug of choice and the overall drug, if there's a difference, means that I can explain this thing. Suppose if you are in a canteen if you like anything, if you like any girl, okay, or if you like any your group mates or batchmate, okay, that's like is called the infatuations. And if anybody have the girlfriend, then that's his things, okay, and this is a drug of choice. And how I will elaborate things, drug of choice means for a particular thing, this is a drug of choice, means if I having these things, then for that scenario that drug will be the actively work over there. Or else the other thing, this is known as the drug of choice. Or over just say NSAID induced peptic ulcer, the teacher is asking the drug of choice means you have to expel the same, the correct answer. Say the correct means that time we cannot use the proton pump. We know the proton pump is a drug of choice, but for NSAID the correct answer will be the misopristol. That is a drug of choice, means this is a drug. Sir, M1 receptor name once again, please. M1 receptors is mainly the two drugs. One is the pyrizinapine and other one is the telenzapine. Pyrizinapine and telenzapine are the two drugs in the M1 receptors. So I think I have discussed all the. One of the Rishabh Dubey, he was just asking that, sir, if any lady is, if any what if a lady is pregnant and you are also suffering from the peptic ulcer due to the NSAID, then what will be the drug we can give? Yes, it's a very good question. Then Rishabh, if as I already said, the for the NSAID, the main drug of choice is the peptic NSAID. If induced peptic ulcer, then the drug of choice will be the misopristol. But misopristol, what it causes? It causes the abortion, okay, and the diarrhea. So in pregnant lady, we can't give misopristol; it's a toxic. So that time we can use the PPI, proton pump inhibitor. So apart from that, if anybody says that the NSAID induced peptic ulcer, that thing will be the misopristol or else the PPI. M1 receptors, M1, Pawan Sharma written, sir, Pawan sir, can we can say that all PPI are hit and run drugs? Yes, the PPI drugs are the hit and run drugs. All PPI drugs are hit and run drugs, okay, because it will come and it will work after 30 minutes and after that it will leave. So the drugs which comes under the hit and run category are the PPI drugs, number one. The second one is the Mao inhibitors, and the third one is the aspirin. Someone is asking me about Mao inhibitors, so I will discuss that Mao inhibitor in CNS classes. For the time being, just remember the three drugs which comes under the heat and run are the proton pump, Mao inhibitors, and the aspirin. Side effect of Rekha Yadav, so can you side effect of the PPI drug? PPI drug side effect, the two side effects. One is the long term can the calcium deficiency and the other one is the vitamin B12 deficiency. Calcium deficiency के कारण it can causes the osteoporosis, and for the vitamin B12 deficiency के कारण it can causes megaloblastic anemia. GARD full form is Champa Rani Samantha. She was asking the GARD full form. The GARD full form is a gastroesophagus reflux disease. It is a surgery disorder or medicine disorder where also the acid productions are also high, and over there we can also use as a drug of choice the PPI in order to decrease the acid. The GARD full form is the gastroesophagus reflux disorder. So I think we have finished this thing, and right now, before anything, I'm taking this other thing, the other besides from the peptic ulcer. Now we'll discuss with the antacids, how the antacids works on this peptic ulcer disease. How the what is the role of antacids in the GIT system? GI सिस्टम में एंटासिड्स के क्या रोल है? Suppose if whenever you will pass your screening examination and you are working in one of the most reputed hospitals of India, anywhere, any state, once in a night you are doing some duty and suddenly in emergency one patient comes and he was giving some history of that. He had a history of peptic ulcer. He used to take medicine, and right now at around midnight 2:30, he used to come to you only because of severe burning pain in the epigastric region. Epigastric region में बहुत ज़्यादा पेन हो रहा है. उसका केस हिस्ट्री में उसका पेप्टिक अल्सर है. वो मेडिसिन लेता है. So इमरजेंसी में रात के 2-2:30 बजे the patient came, and how we will treat this? Okay, and that thing, say, this is the ulcer. Okay, this is just look at this diagram. This is the ulcer, the where the indication is arrow is there. This is the ulcer. So, and how it will work whenever the HCl will touch this ulcer. Okay, so the patient will experience the pain in his or her epigastric region. So what we have to do, whenever the HCl touches that ulcer region, the pain will occur. So the patient came at midnight 2:30. We can give that PPI drug, we can give that the M1 receptor, we can give the H2 blocker, anything we can give. But that's the drug of choice, PPI. But at that time, for the first action, we can't give all these things because at that time in emergency situation we need fast thing, means we need fast prognosis. That thing may take a long time. So getting for the first prognosis of the patient, we used to give the antacids. What is the role of the antacids? The antacids is nothing. What he is to do, mechanism and action of the antacids. Antacids, what he is to do, it just neutralizes the acid production. The HCl which is produced over there, it neutralizes the acids. Means so there will be no acid. If there is no acid, then there will be no touching point of the ulcer region, and the pain will be subsequently decreases. So whenever the HCl production, whenever the acid touches that ulcer region, pain occurs. So in order to not to be happen that pain, so the patient doesn't suffer pain from that pain, what we'll do, we'll give the antacid. What will be the role of the antacid? Antacid neutralizes the acid, and due to of the neutralization of the acid, it decreases the pain. And there are the two things in the antacids. Was one is the aluminum hydroxide and other one the magnesium hydroxide. What the aluminum is to do, it causes constipation, and what is the magnesium is to do, it causes the diarrhea. There are two fastest pain reliever antacids in peptic ulcer disease. One is the aluminum, which causes the constipation, and other one is the magnesium, which causes diarrhea. So this much I think so it will be enough. So in GIT today we discussed about the peptic ulcer disease, and this is a cycle we discussed how the acetylcholine, histamine, gastrin, PGE2, proton pump. So, what is the main treatment of the PUD? Decrease acid by the three things. We have to hydrogen potassium pump, which helps secretions of the acid. This pump stimulated by the acetylcholine, histamine, gastrin, and inhibited by the PGE2. M1 blockers drug, the two drugs, pyrizinamide and telenizapine. The drugs which comes under the H2 blocker are the ranitidine, famotidine, nizatidine, cimetidine. Apart from that, the one drug which is very important is the cimetidine due to of its side effects. After the PPI drugs which comes under the PPI, the ones are named the omeprazole, lansoprazole, esomeprazole, pantoprazole. These are the drugs which comes to the PPI drugs. I've already discussed how they roll and what are the drug of choice in the GERD and the benign gastric ulcers also. And after that, the antacids. There are two antacids which are the fastest acting antacids. What is the role of the antacids? If anyone asks you, just remember the role of the antacids. It neutralizes the acid so that the acid doesn't touch the pain ulcer. If it doesn't the pain, if it doesn't that heal ulcer area, the patient will not be able to feel pain. So the role of the antacids is to the neutralize the acid. Whenever it will neutralize the acid, pain will not occur. So the two antacids, the fastest acting are the aluminum and the magnesium. But please remember the MCQs used to come, aluminum causes what and magnesium causes what. Okay, so over here I used to remember that MD, M means magnesium causes diarrhea, and AC, aluminum causes constipation. Okay. Hello Priyaji. Hello, can you hear me?
Yes, yes, Jaydeep.
Okay, I think this much for today only.
Okay.
Okay, if anybody can want to speak, I have almost whoever the questions and answers, whoever they have mentioned in the chat box, I've already solved all their problems. Okay.
Okay, okay. Thank you, everybody. We will update you with the schedule of the next class. Thank you. Good night.
Okay, please one more thing. If
Yeah, yeah.
someone is taking giving some, sir, sir, what is PUD? PUD is peptic ulcer disease. Sir, M1 receptor name once again. M1 receptor is the pirenzapine and the telenzapine. The two drugs which comes under the M1 Shweta is the pirenzapine and the telenzapine. Okay, thank you, Piaji.
Thank
Hello.
you, Dr. Jaydeep. Thank you.
Okay, just give me the feedback how they like or not. Okay.
Yeah, yeah. So students can share their feedback. Did they like the class or not? If they need anything new, they can write.
Okay.
Thank you, everybody.
Thanks, sir. Thank you. Good night.